Well, welcome to today's update. Now, I'm going to start off today looking at the vaccine that has been officially approved in Russia, and we'll look at quite what is going on there. And the bottom line is I have my doubts. That's the bottom line on that one. And then we'll go on and look at the United States, and we'll talk about motorcycle rallies and ponder if there's a super spreader event going on there. And we'll also talk about schools. Now, I hate those videos that don't tell you what's going on till you get to it. So I always try and give the bottom line. But with schools, it is a bit difficult. But my opinion is moving very much towards the thinking that schools are super spreading environments. And if you watch yesterday's videos on infectivity in children and in young people, you'll know some of the evidence that puts my thinking in that direction. Then we'll look at difficult situations in Brazil, some reports from the United Kingdom. New Zealand had 102 days without a case, now they've got 4, unfortunately. Then brief report from South Africa and Syria. So that is the plan for today if you'd like to stay. So diving straight into the detail with Russia. Now, Russia, this is the number of cases getting on for 1,015,000 deaths. Now, we've done previous videos where we've looked at this, and what we found was it's remarkably difficult for doctors to diagnose deaths as COVID-19. There's quite a sophisticated diagnostic process required. And of course, we can't forget that, was it back in February, March, we had that tragic case of 2 doctors that fell out of windows. So we suspect all the doctors in Russia now are doing exactly as the requirements demand. So the 15,000 deaths in Russia is a number that's not believed by the World Health Organization. It's not believed by the European Union either. But that's the official figure. So that's all I can write down at the moment. But what I wanted to talk about mostly with Russia is the vaccine. Now, this vaccine, unhelpfully in my view, has been called the Sputnik Program. Now, if you're even I can't remember this. You've got to be a little bit older than me to remember this. But the Sputnik, of course, was the initial satellite that the Russians put into space, and they got there first. And it was basically a silver ball about that side, and it went around the world going ping, ping, ping. But it did demonstrate the fact that the Russians got into orbit first. So there's this kind of race thing about that. It was called the space race. Well, this should not be a vaccine race. So unfortunate title there, but never mind. Now, this vaccine has been given regulatory approval. They've given regulatory approval to a COVID-19 vaccine with less than 2 months of human testing. Now, to carry out a randomised double-blind controlled trial on the efficacy and safety of a vaccine takes more than 2 months. It is not physically possible to do an adequate phase 3 trial in that time. As I understand, phase 3 clinical trials, simply not possible. And indeed, the Russian authorities admit it's not yet completed its final trials. But they've called their vaccine Sputnik V. So that's the name they've given it. The Sputnik V vaccine. Now, normally about 10% of clinical trials are successful because, remember, we have to demonstrate safety and we have to demonstrate efficacy and practicality. But there's no need to do clinical trials because Mr. Putin already knows. So Mr. Putin has said it's completely safe. So Mr. Putin knows it's completely safe. Therefore, you can draw your own conclusions. Mr. Putin said it's completely safe. Clinical trials not completed, but he already knows it's safe. I know that it works quite effectively, forms strong immunity, and I repeat, it has passed all necessary checks. So that's what Mr. Putin has said. And he plans, or the plan is to go into mass production by the end of the year. If it works, fantastic. Doctors, nurses, medics, teachers in August and then in September. So basically rolling out this month. And of course, it's voluntary. It's a voluntary scheme whether nurses or doctors or teachers accept this new vaccine. So pleased to see it's voluntary. Now, mass rollout in Russia is expected to start in October, the Russian population. Now, to be fair, I don't want to be over cynical here because what essentially the Russians seem to be doing here is they are moving the phase 3 clinical trial into the post-production, post-utilisation stage. Then if it turns out to be non-efficacious, or if it turns out to be toxic, then one would assume that the vaccine would be withdrawn. So they're kind of doing the phase 3 clinical trial as they go along, really. And given that a phase 3 clinical trial has to be done on people anyway, it's not, maybe not quite as bad as it sounds, but it's inconsistent. It's inconsistent with the way that it's done in Western countries. But as long as they're monitoring the results really carefully, and I've no reason to assume they won't, I'm sure they are monitoring the results really carefully. They will be. I mean, I'm not being cynical there. They will be monitoring this carefully. So they should know about efficacy and toxicity fairly soon. But as we say, it's already being rolled out on, it's already licensed and being rolled out on medics and teachers. Requires 2 doses. That's the same as most Western vaccines. So that is more than reasonable. It consists of 2 serotypes of a human adenovirus. Now, adenoviruses are a different type of virus to coronavirus. But the thing with adenoviruses is the vaccine production methodology is all known and it's all in place. So to do adenovirus vaccines is not too difficult. And what they've done is they must have tagged on an S antigen to these adenoviruses. Now, what is an S antigen? Well, as you know, the coronavirus has these, it's got the middle bit, it's got the ribonucleic acid inside, it's got an envelope around there, a phospholipid envelope, and then it's got these spike proteins, as you know. And it's these spike proteins that are responsible for the infectivity of the coronavirus. And the S proteins are proteins of this spike. So the S stands for spike. It's the proteins that are in this spike part. So the vaccine contains proteins that are very similar to this spike protein. And they are antigens in that the immune system will recognise them as being foreign. Therefore, the aim is that the immune system will make antibodies to these spikes. And these antibodies will then fit onto these spikes like this. Not drawn to scale, of course. And they will block these. They will block these spikes. So that's a Y-shaped antibody there, blocking that spike. And that can neutralise it and stop that spike from working. It can also help the antibodies to destroy the virus. So that bit there does make scientific sense. But we don't know the efficacy, we don't know the safety until it's practiced on large numbers of people. The platform has been developed over 20 years. That's using the adenoviruses. So it does kind of make sense. They've gone for an existing technology here that's known about, a known vaccine production technique. So rather than start a new one from scratch, they've kind of adapted another one. And of course, there was also news about Russian hacking of vaccine programs in Western countries. And we did comment that that was a pity because it means that knowledge is not being adequately shared. Now, this was used for an Ebola vaccine, so we know that this can work. It's planned to manufacture the vaccine in Brazil. Now, if it does work, and I really, really hope it does, you know, this has got the potential to save millions of lives in South America. So it looks like the Russians are already sharing it with the manufacturers in Brazil. If so, that is good news. Let's hope the American and UK vaccines are shared worldwide as well. Good rumbles and noises are being made about that, but we haven't seen anything firm on that yet. And clinical trials on the Russian vaccine are going to be carried out in the United Arab Emirates and the Philippines. So what do we conclude about this vaccine? Very unconventional for sure. May turn out that it doesn't work, but just because it's being done differently from the UK and the United States does not necessarily mean it's wrong. but clearly I've given rise to some concerns as I've gone through. So I've tried to make that a balanced report. I have spent quite a long time reading that, so that is my balance of my understanding at the moment as regards to the Russian vaccine. Now, moving on to the United States. Well over 5 million cases, deaths 164,545 deaths this morning, I'm afraid. Now, the South Dakota Sturgis motorcycle rally. Right. Nothing against motorcycles. I'm a motorcyclist myself. But 250,000 of them have come from all different parts. This is to South Dakota, all different parts of the United States. They've come from all different parts. It's a 10-day gig. Pop festivals and bands and drinking. Very little social distancing, very little mask wearing in the videos that I've seen, not saying they're representative. But certainly these mass gathering events are potentially super spreader events. But after this, well, firstly, when they're there, they're going to be mingling with the local population of South Dakota, of Sturgis to some extent. Could be an issue. But then they're going to go back to all different parts of the United States, probably mostly riding their motorcycles, stopping in diners, stopping in cafes, using public toilets, mixing with people, going into shops on the way back, and then eventually going back to their home environment where, of course, they're going to interact with people when they get home. So, given all that information, do you think that this could be a super spreader event? Now, let me think. I'll tell you what, I'll let you think. I think we've got a super spreader event. Now, going back to school, I have been asked so many questions about going back to school. And of course, I can't advise you what to do with your children or dictate policy. But we did look at evidence yesterday that showed that children under the age of 5 have a higher viral load than older children and adults. 10 to 100 times higher viral load, which is 1,000 times more virus than you need to spread, viral load than you need to spread the virus. So to me, it's the preschool children that are probably most potentially infectious. That's not widely known, but to me that's the main source of infection. But what about children, older age groups, 6, 7, 8, 9, 10 through to 16, 17-year-olds? Well, they seem to produce the same amount of virus as adults. Therefore, to me, I would surmise from that means they have about the same degree of infectiousness and infectivity as adults. I think they can spread the disease just the same as anyone else. Now, there's been a lot of misinformation on that, but if you watch yesterday's video, we do quote quite a bit of science on that. If I've misunderstood that science, I'll be the first to come back on and say I've misunderstood it. But this is my thinking at the moment. So a school with, say, 12, 13, 14-year-olds will spread the virus in exactly the same way, as I understand it, from the viral transmission and the viral loads in those individuals, as a workplace would. But children under the age of 5 could potentially be super spreaders and be very, very contagious. That's my current understanding of the science. If it changes, we'll get back on that straight away. But for example, things that support that. So Georgia, Cherokee County, 6 days back at school, the policy was no mask wearing for students. I think teachers were required to wear masks, but the students weren't. After 6 days, 59 confirmed cases. That resulted in 900 people needing to be quarantined. To me, that is empirical evidence. We can see that has just happened, of children spreading the virus just the same as adults would. The idea that children do not spread this virus like adults is not substantiated by that. And of course, these children are going to go home, some to multi-generational households. Older people could well die. So one example of schools spreading the virus there. Another one in Florida. Again, schools reopening, masks encouraged, not mandated. And the people there were saying space as space allows. You know, well, what do they mean? Space as space allows. You know, well, space out if you can, but if you can't, hey ho. You know, the virus will leap at the opportunity. Under 17-year-olds in Florida. Now, I'm not sure if this is all of Florida or just particular parts, but the incidence in under 17-year-olds up by 130%. And we noted yesterday the great increase in young people and children in the United States. I think it was a 90% increase in the past 4 weeks nationally. 90% increase in the past 4 weeks. So here in Florida, 130% increase in younger people. Now, still in the Americas, Brazil is one of the main areas of the country, areas of the pandemic. We know that the cases are still underreported there as well. Okay. Now, the UK, particularly in indigenous areas, the cases there are underreported. Now, the UK has had more cases lately. I didn't get the latest figures, but that was the increase on Sunday. Tuesday, it was an extra 1,148. So increasing cases in the UK. And that figure, that 1,148 new cases, was the highest daily toll since June the 21st. UK authorities stopped publishing daily updates on the numbers of deaths from COVID-19 on July the 17th. Now, I don't think we've started publishing death figures again yet. What is going on here? Now, I don't think this is conspiracy. I think this is just administrative incompetence. But as I understand it, the UK is not publishing daily death figures at the moment. Now, we believe they're not particularly high because the increasing cases that we're getting in the UK will feed through to deaths in the next few weeks. So there's no question at all in my mind there'll be increasing deaths in the next few weeks. Now, the Office for National Statistics is still giving excellent data, of course. Do click and browse around for yourself. Lots of fascinating stuff. Of course, it's always a bit behind. So the week for the 27th of July to the 2nd of August, 28,000 people in the community had COVID-19. A relatively small percentage of the population, fortunately. Week ending the 31st of July, 193 deaths in the week involved COVID-19, 2.2% of all deaths. So that was the week ending the 31st of July. So we know these figures are accurate because these are taken directly from death certificates, but we don't know there's a delay. So I'm surmising that the amount of deaths aren't particularly higher than that at the moment, but they will increase because of the increasing cases that we're seeing. So we are seeing this gradual increase in cases in the UK. As indeed, we looked at this yesterday, as indeed we are seeing in quite a few European countries, Spain with the most rapid rate of increase. Now, New Zealand, 102 days without a case. Then yesterday in Auckland, 4 new cases in one family. 4 new cases in one family in Auckland yesterday. Now, strange where this came from. I think it will transpire, but there's 4 cases in one family. There's 7 in the family. And we know there's kids at school and adults at work. And we know that they've had symptoms for 4 or 5 days, so they will have already spread the virus around. But the source is unknown. Where this virus came from is not yet apparent. Because 102 days without a case, and then 4 positive cases in this family. Now, we don't know the details of the family. We don't know the travel history. What I suspect is this has been imported from abroad somehow. Because I don't think the virus would lie dormant for 102 days. It only survives on surfaces for 3 or 4 days. And because there was no... Or has the virus been... Has there been a very small number of cases where the virus has been... someone's got the virus, been asymptomatic, passed it on to someone else who was asymptomatic, passed it on to someone else who was asymptomatic. Even that 102 days would seem a long time. I suspect this is an imported case, but we'll find that out, and that'll be interesting to find out. So the source so far is unknown officially. Now the New Zealand authorities, because the kids have been at school and the adults have been at work, they're doing extensive testing to see how far it's spread, QR codes to monitor where people have been, which is always good. So importance of maintaining data surveillance there, because this case has just popped up. Now the New Zealanders have imposed phase 3, what they call phase 3 restrictions, just the usual restrictions that we've looked at many times. Some restrictions in the rest of the country. Now South Africa. Now I get a lot of emails, and I don't read many of them out to you, but the situation in some countries is hard to ascertain accurately. So I'm going to read you the gist of an email from South Africa. Now I know who sent it. I've been in correspondence with them for a while. I can't verify its accuracy, but there again, we can't verify the accuracy of a lot of the official news reports either. Hi from South Africa. Numbers seem to stabilise here, but it's only an illusion. The truth is people are getting sick but don't get tested. There was an excess of 11,000 deaths in one single month with no explanation offered. People died and were buried, especially in rural areas, without anyone asking questions, as a huge proportion of those had comorbidities. So it looks like there's been a lot of people dying without getting tested, and there's been an excess of 11,000 deaths in the month that hasn't been explained. People are also scared of being tested and forced to close their business and their livelihood. Too many jobs have already been lost. I know of a lot of people that were and are sick and chose to ride this out without reporting it. Can't blame them either. We see a lot of fear and a lot of confusion. People wear masks and most people are trying to stay healthy. Unfortunately, there are a few clowns who defy all efforts to be careful as well. There is a lot of backlog on tests done by the state, waiting as long as 2 weeks for results. Now we know from an epidemiological point of view, if the results take more than 3 days to come back, they're pretty well useless. That was an article last month in The Lancet. And a lot of people turn to private labs for quicker results, 2 to 3 days. Unfortunately, there are no guidelines here, and the test can get quite pricey, especially if there's more than one from the family who needs testing. So why test? If you go to a hospital, it is mandatory, but if you can ride it out and stay at home, you go for that option. So please don't believe the official numbers, because we don't. So that is an email from someone I do know in South Africa, but they've asked not to be named because they fear the authorities will take actions against them. So they don't believe these figures. Now Syria, again, remarkably difficult to get news from Syria. So again, this is someone from Syria who I know who they are. The situation in Syria became very critical. I think most people now are sick with the virus. Many of my friends' family were hit hard by the virus. I'm living abroad, but did not manage, but have been informed how awful the situation is at home. The population are still practicing bad hygiene measures. People kiss on the cheeks multiple times. Many people were detained in prison and were released due to prison's ability to handle the outbreaks. Those latter met with a lot of people in sort of welcoming parties, and you can imagine what happened afterwards, after people have been in prison for a long period of time. Pharmacists lack even medicines for blood pressure and diabetes. I know this because my own family needs medicines for blood pressure and diabetes but can't obtain them. Many people have underlying health conditions or malnutrition, and they cannot afford to see the doctor or acquire medicines. More elderly people are dying from COVID than young people dying from war. Sanctions by the United Nations that crippled the economy is affecting the whole population, and inflation rate is increasing daily. I don't know what my family should do in these circumstances, and I'm quite anxious if this virus will start a civil war or some meltdown even more vicious than 2011. Muslim tradition implies that a human death date is pre-written by God, so people are not even trying to avoid getting infected. We've talked about this fatalism before. And of course, no one could speak up because of the totalitarian regime. Official numbers are in hundreds. It is ironic because I have friends from all over Syria saying they know at least 30 people having the symptoms of flu, and some even tragically have died. I am writing to seek some kind of advice that we could do in such circumstances. If you want to mention any of this information in your videos, please keep me anonymous, since I am afraid that the regime would harm my family and friends. So just applaud the bravery of this person from Syria, speaking out in that way, and yeah, quite a moving email really. So the official figures from Syria are that 53 deaths, 1,327 cases in the entire country, as per Johns Hopkins 1 hour ago. Now, I'm going to read one more very moving email as well. Now, we know that young people normally get milder disease, but it's not always the case. So I did a video a few days ago on heart complications based on scientific publications. And when I saw this video, my jaw hit the floor, says this. I know who this is again. I'm not mentioning their names for obvious reasons. This February, I was feeling poorly, unbelievably exhausted, and with a dry cough. At the end of the month, I went into the emergency room with heart problems. I was told I had a first attack of atrial fibrillation. Now, the atrial fibrillation, the top chambers of the heart, are the atria that's supposed to contract and pump blood through to the ventricles, and it's the ventricles that pump the blood out into all of the systemic circulation. Now, when the atrial fibrillation happens, instead of doing that, the atria muscles just flutter like this, reduces ventricular filling. So they can still function, but it's not good to have, and you can get palpitations, and the pulse is irregularly irregular. So I was diagnosed with a first attack of atrial fibrillation, so never had it before. And tested showed I now have low left ventricular ejection rate. Now, ejection fraction, and that means the left ventricle, which is the chamber of the blood that's pumping chamber of the heart that's pumping blood to all around the body, the heart itself, the brain, the kidneys, the arms, the legs, is no longer pumping as effectively as it did. Now here's the shocking sentence. I'm 35 years old. And then there's some personal details. And then the person said, I didn't put the pieces together until now. So just obviously the person who wrote that email will recognise it, and I wish you well. I do hope you make a full recovery, and I'm sure everyone watching this video having fun, ignoring what could go wrong, and then, well, 35-year-old. Okay, thank you for watching as always.